My name is Greg Adey. I'm a urologist at Fore River Urology, a Department of Mercy hospital. As a urologist, I spend my time managing disorders and problems of the genitourinary system. Benign prostatic hyperplasia, or also known as BPH, is one of the most common things that a man will experience over the course of his life. In fact, about 50% of men at age 50 will have symptoms from the enlarged prostate, and almost 3/4 of men in their 7th and 8th decade of life will have symptoms from enlarged prostate. Things like frequency of urination getting worse with time, or strong urges to run to the bathroom. Most commonly for men, it's usually seen at night, with getting up more and more times during the course of the night, starting typically around age 45 or 50 in a lot of men, and then progressively getting worse. The important thing about prostate cancer screening is that it's inclusive of all parts. So for men that are out there, they should be having a PSA, prostate-specific antigen blood test, done annually when they meet the definitions that we spoke of earlier, as well as the rectal examination of the prostate. Fortunately, the symptoms are very treatable. A lot of men are concerned that they might be signs of prostate cancer, and they always could be, but most commonly they're a sign of a benign growth problem. We have a much higher incidence of prostate cancer in the United States than in many other countries, and one of the suspicions is that that relates to diet. A lot of people are guilty of drinking caffeinated products, particularly coffees and teas, particularly in this day and age with coffee houses on every corner. The caffeine is a real irritant to the urinary system as well as a diuretic, so it pulls water from our system. Alcohol is another frequent irritant to the bladder. So typically we'll start with managing those behaviors. The primary care providers in this community, as well as most communities, are really very good at diagnosing this problem and then seeking the help of specialists such as myself or any urologist for additional management of these problems.